possible, right? In
Yes.
this virtual world. But yeah, I feel so excited to be here with you guys talking about a topic that I'm passionate about, which is, I mean, multiple sclerosis. Of course, obviously, I have a passion for that with all the training I've invested in, and love to treat patients with MS. And the focus of the topic today is on fatigue, and I think it's such an important component and symptom of MS that I think needs to be addressed because it doesn't get as much attention as it really should. Um, so I just want to start out. You guys know what MS is. This is just an overview for those of you who are potentially newly diagnosed. So MS is a chronic demyelinating neurological autoimmune condition. And it involves breakdown of myelin, which appears as lesions on the brain MRI and spinal cord. So for most of you, this is probably how you were diagnosed with MS, is your physician found lesions on your brain or spinal cord. Also, there can be results from the spinal tap, which we find these specific proteins that represent breakdown of myelin on brain neurons, and those are called oligoclonal bands. So that's how MS is diagnosed. There are different types of MS. So depending on how your MS presented, if it presented with an attack or a relapse, which is the vast majority of folks diagnosed with MS, so it's around 85% of people have relapsing remitting MS. About 50% of those individuals may progress into secondary progressive MS. So that usually tags along after relapsing remitting. There's also primary progressive MS, which is much more rare. It's about 10% of people with MS that don't have clinically defined relapses, but progression from the get-go. And then there's a very early MS or potentially benign MS, if you've heard that term. And that's usually either radiographic isolated syndrome or clinically isolated syndrome. So you may have heard those terms just from your physician in diagnosing you. So this slide is representing what disability is, and I think it's different for everyone. Some people don't have a lot of disability from their MS, nor ever will develop disability, and others experience a lot of disability from the very beginning, or not a lot of disability in the beginning and find a rapid decline more later on in life. So everyone's very different, and I'm sure you recognize this if you've been in contact with others with MS. One MS does not look the same as someone else. And when I think the tendency when we, I say we, being MS specialists, sometimes when you're in our clinic visit, we may put more of the focus on what is visibly identifiable as disabling. So that's usually ambulation, it's balance, maybe it's a tremor that we're seeing, or something that we can visualize. However, I think sometimes what I hear from you oftentimes is that the invisible things are what can be very disabling for you at home. So there are things underneath the surface that doesn't quite meet the eye that definitely needs to be focused on. And usually we don't hear about it unless you tell us. So these are, I think, some reflective points for yourself to think about. Are some of these issues really causing me problems? And I'd encourage you to journal about it and bring that to your clinician. So some of those symptoms are cognitive impairment. Another term for that is just memory loss or memory changes. It's usually very different than dementia type of memory loss. So this is, trying to think of the right word or say, you know what you're talking about, but you can't think of the word of what it's called. So we call that word finding, or there's executive function, which is working memory or focusing. So if you're trying to follow a recipe, it might become difficult to do that. And other things, vision, vision changes over time or from optic neuritis, sensory problems. This could be numbness or pain, bladder or bowel function. This could either be losing control or not being able to hold it or not able to initiate a urine stream, maybe constipation or diarrhea or flip-flopping. Sexual dysfunction can also occur and is common. Mood changes, this could be depression, anxiety. There's also a higher percentage of bipolar, schizophrenia, and other mental illnesses too. And fatigue, which is the focus of our discussion, is highly prevalent. 81%, as you saw in the email, of individuals living with MS. I'm sorry, 83% live with this. And I was talking with Michelle about this when we were, talking about the topic that we were going to focus on. And I said, I'm surprised, but not surprised by the statistics of the prevalence, because I thought, probably the literature will state we're usually a few years behind in the literature. And I thought, yeah, we might see about 65, 60, between 65 and 70% of people living with MS having fatigue. But it was up to 83. And I will say in the clinic setting, the vast majority of the folks I treat for MS do have a lot of, most of them have fatigue. Fatigue can be described as different things. We're going to talk about that. And I think, the point here is from these quotes, you can see that it does exert significant impact on quality of life. I think everyone gets tired, and I think that can get easily misunderstood as not being a big deal. However, fatigue does impact quality of life and can be a contributor to unemployment and family problems potentially. Again, it's not something you can see from the outside, and so can therefore be easily judged or stigmatized as lazy or not wanting to do it. So some of the concepts of fatigue that I have quoted here, it's a feeling arising from difficulty in initiation of or sustaining a voluntary effort. Maybe you can kind of connect with some of these. Or an overwhelming sense of tiredness that is out of proportion to performed activity. So, cleaning the house, you can expect to get tired, but the extent of tiredness that you feel is out of the ordinary. A feeling that relates to the lack of motivation to deploy resources and engage in high effort performance to cope with their situation. So again, just kind of, I don't feel like doing that. I know I have this to-do list of very important things piling up, but digging deep and finding the motivation, the energy to do it is nearly impossible. And that could be the case for some people. So originally when I had these slides, they were pretty scientific. So I'm going to be using a lot of analogies to just kind of communicate to you some of the reasons that have been, they're more theory still. I think for the most part, there's not 100% identifiable cause for the fatigue. However, there are some things that make sense. And so that's what I'll explain to you, because I know I get the question all the time, why am I fatigued? Why does fatigue happen with MS? And for a while it was like, well, I suppose it's this, or it could be this. But this is what so far what the literature says. So one of them is where the lesions are located. So this is interesting. I think there's, right by the midbrain, there's something called the hypothalamus. And there's a lot of brain hormones that are produced from there that make us feel happy, make us feel motivated, give us pleasure from things. You know, when you get an award, that feeling of accomplishment, and you want to do it again, and you want to do it again, or you eat a piece of chocolate cake. Why does our brains know that we like chocolate cake? It's because our brains produce dopamine. And that's the award hormone with our brain. There's also something called orexin with an O. And orexin has, it tells our brain that, oh, we should be awake right now. And we need to be, you know, we need to be alert because, you know, we have the afternoon, we got to get stuff done. That's what orexin does. And when lesions are located near the hypothalamus, those hormones can be depleted. So our brains aren't producing as many of those hormones, and I call them awake hormones, or those motivating hormones are lower than the normal brain without MS lesions, maybe located in that spot. So therefore we have this imbalance, right? We have the imbalance of sleep and awake hormones. So that's one potential cause for the fatigue. Another part, and it's I want to be clear that it's not one or the other. It's probably a combination of these things for everyone, and potentially other causes, which we'll also, you know, talk about that as well. So this one, I don't have a lot of words on here, but this image is where I want to draw your attention to. So you can see this woman is pouring a glass of water. And I know whenever I pour a glass of water out of a pitcher, I feel like it's so heavy. You know, you go to, I prepare to pick this thing up because I don't want to drop it. I don't want to spill water all over the floor. So I pick it up carefully and make sure I pour the water in the glass. So when we do that, I explained a little bit of that. My brain is preparing how much force and how much energy it's going to take to lift that pitcher of water and pour it in a correct way so that the water doesn't go all over the place. So I have this quote, oh, I thought it would be as light as a cotton ball. It's a lot heavier than I thought it would be. So this is what the MS brain is doing and can't quite get correct. So how much energy it's going to take to require to do chores, or how much energy it's going to take to make my lunch or make my meal. The brain has an inaccurate judgment of how much energy it's going to require. And so chronically, when that's happening day in and day out, of this misjudgment of how much energy is required, that contributes to fatigue for people with MS. Kind of interesting, right? This is all happening beneath the surface because this is all involuntary stuff that our brains do day in and day out. So another one, kind of similar to the previous analogy, where, you know, how much force is it going to take to pick up this pitcher of water and pour a glass of water? That part is inaccurate. Another issue, I suppose, is what you can say with having MS is that not enough neurons are recruited to perform a task. So think of a soccer team where you have 3 players on one team and you have, I don't know how many players are on a soccer team. Let's just say 15 is correct. So don't judge me if you're a soccer player. So you have 15 on one end and what did I say? 5 on another. And so it's like the coach is constantly trying to recruit players. Like, we need more players, we need more players. But by the time they have to play a soccer game, the coach is inadequate in recruiting enough soccer players to compete with the other team. And so the same thing, the brain is constantly going, we need more neurons to exert enough force to, you know, like the image, lift these boxes, or you know, go make a meal or go to work and perform you know, both on a cognitive level and physical level to do your full work duties. So that's another contributor to fatigue, is that those neurons that have been affected by MS and accumulated lesions, they're not as useful. And so our brains are amazing in the sense that they try to find other ones. We need more, well, this neuron is out of commission, we better go find some more. And the more MS lesions that are accumulating, the more inflammation that's involved within the central nervous system around the brain, the less neurons that are available. And then therefore the individual ends up experiencing a lot of fatigue. So this is under normal circumstances. We have the neuron, sending messages to other areas, and those are called synapses, which is it's basically where one neuron connects to another. So it's like a game of telephone. You have one signal getting sent to the other. Well, if you really play a game of telephone at home with your friends, the communication gets messed up by the time it gets to the last person. And that is actually a perfect analogy of how neurons are communicating when you have MS, is like an at-home game of telephone where the message isn't quite as clear, or not quite as strong, or maybe it doesn't get there at all. Whereas a healthy neuron, all the signals sent out are identical. So, understanding that, hopefully the previous analogies make a little bit more sense, just for a bit of an understanding, why do I feel so fatigued? And it's not because you're getting old or because you're lazy or anything else. It's very much a pathological process that's going on that is contributing to that symptom. So I'm going to switch gears a little bit and encourage this component of communication, because like I said, I think a lot of times the invisible things, the things that aren't obvious, you have to bring those to the table when you go in to talk to your doctor. And sometimes making a list of those things, thinking about them prior to going to your visit. We all get a little bit anxious. Sometimes we can't think of them when we're, in the office visit. So taking time to reflect or jot them down is always a good idea. And with fatigue, maybe you're thinking, well, I don't know if this is an MS thing. I haven't been sleeping very well. Maybe I should talk about it with my primary. I encourage you still to talk to your neurologist about it, or whoever you're seeing at the time, because we can kind of work through things to figure out if it is MS related or if it's not. Some of the MS unrelated causes that absolutely would need to be ruled out or tested for are anemia. So this is where your iron levels might be too low, and that could cause some fatigue. Hypothyroidism, so underactive thyroid can contribute to fatigue, and that's discovered with a blood test. Sleep disturbance, and I think this is another common thing, whether it's because you have to get up to use the restroom, you're not sleeping well because of muscle spasms or pain waking you up. Maybe it's not because you're sleep disturbed, it's because your spouse's sleep is disturbed and that wakes you up and now you're not sleeping very good, or what have you, but that can contribute to fatigue as well. We mentioned pain, and I think even if pain's not waking you up, if you're in chronic pain, the brain gets tired of feeling pain all the time. And so, people with chronic pain often have chronic fatigue. So that may need to be addressed separately. And then depression as well. So individuals that are struggling with depression, even chronic anxiety, that can also contribute to a sense of feeling fatigue all the time. There are actually very limited studies for how MS medications or disease modifying therapies, which is what DMT stands for, how they can improve fatigue. But there is a little bit of data for glutaminyl acetate, and you may recognize Copaxone, which is the brand name for glutaminyl acetate. So that does have a basically the data says it might reduce fatigue, so it's not 100%. But they did a study comparing it with beta interferon, and individuals on glutaminyl acetate or Copaxone did feel like they were a little bit less fatigued than the beta interferon group. The same for natalizumab, which you may recognize as being Tysabri. So this one may also decrease fatigue in patients with MS, and that's from a study in 2013. And what's interesting, I think some of my patients that are on natalizumab or also known as Tysabri, they feel like they experience the fatigue a little more right before their infusion, because it's an infusion every month. And then the Tysabri kind of gives them a little boost. So kind of interesting. It's not for everyone. It's certainly not a treatment for fatigue, nor do I advise if you experience fatigue to go on one of these therapies. So that's how I'm communicating here. I just think there may be that question of, can any of the MS FDA approved therapies help with my fatigue? And I think overall the answer may be no from your physician, because it hasn't, like I said, there's not 100% yes, nor is that the main intention of the therapies. But it's interesting to see that there was a little bit of positive benefit on fatigue for these two. Okay. And moving into other management recommendations. So currently there's a lack of mechanism guided treatment selection individual patients. So meaning that not everyone is going to benefit from medications, nor are they 100%. They just are not for MS fatigue, and that's the unfortunate thing. However, you may find something that really works, but it's helpful to know that there are medications that you can take safely for managing fatigue if the fatigue is that imperative on your daily life or your quality of life. So amantadine, I think, is an older medication that has been used off-label for treating fatigue. Also stimulants, so this could be modafinil, armodafinil, it could be attention deficit disorder medications, Adderall or Ritalin or Concerta. Those could be some that may be recommended by your treating physician. And then antidepressants, also, especially if there's a depression component that may be playing into the fatigue, antidepressants can work very well. And then there are non-pharmacologic interventions, meaning not medication based, but more of a lifestyle, either incorporation or adjustment, can also be beneficial. And some of those that have been looked at in the data, I think, well, I should put exercise at the top because exercise does show a lot of beneficial things for fatigue and cognition, specifically walking. And if you have trouble walking, it doesn't have to be that. Doesn't mean, all hope is lost. I think, anything you can do. So even if it's chair-based yoga, if it's, stretches in your bed before getting up, anything you can do to get the blood flowing and moving, especially nowadays with the pandemic. We're not going to the grocery store as much, if at all. We're not going out to our doctor's visits. We're just not walking around as naturally doing day-to-day things as we used to. And so making a point to schedule those times of exercise and movement is really, really important. And it gets the blood flowing, it gets those endorphins going, which endorphins are dopamine, epinephrine, norepinephrine, serotonin, all of those are what we just talked about in being depleted in potentially for those living with MS. And so exercise actually gives you more of those hormones. Mindfulness-based cognitive therapy, or I think anything that that you can do to bring yourself into the present. You know, praying could be really helpful. You know, stopping. You know, when you think about it, our brains are constantly on. There's constantly input coming in. Even if you have the television on and you're not really doing anything, there's still sound coming in, and your brain is having to work and process the sound. We're constantly thinking about, you know, what am I going to do in the next hour? Who's talking to me right now? So giving yourself that peace and quiet, that can be mindfulness too. Just cutting out all of the input and just for a little bit. And even if your brain's still working, at least just silencing your environment for a little bit can rest the brain. And even 15 minutes, it doesn't have to be a long time. And that can kind of reset you. And, you know, cognitive behavior therapy, I think, you know, being grateful. We're approaching Thanksgiving, so it's a good time to kind of initiate that potentially. Think about positive things, what's going right, what you're grateful for in the day, that you're grateful you woke up that day. Maybe that's all that there is to be grateful for on some days. But making that a focus and a regular thing. And then socializing, being around friends, it makes you, whatever makes you happy, you know, that's, we have more of those happy hormones in our brain being released in those situations as well. Okay, and I have these cute photos on the side because these puppies are enjoying themselves playing ball. And so I think the point being made with those images, and also we're going to be hearing a lot of personal tips from you guys about what's worked. But essentially, you want to find what you enjoy, because again, if you can feel enjoyment out of something, that in and of itself is beneficial for fatigue. You know, taking naps during the day to refresh, getting adequate sleep and improving your sleep hygiene, not staring at a phone or having the TV on while you're trying to go to sleep. You know, those are improving your sleep hygiene, and what I mean by that. We talked about exercise and medication. You may or may not have heard of the spoon theory application for daily activities. And what that is if you can imagine that, you know, you have this bowl of energy for the day, and as you take out spoonfuls of energy with different tasks, you know, for example, I might say, oh, I need to go to the grocery store today, and then I need to, you know, fold clothes, and then I need to make dinner. So I may say, running errands, I really get tired after that. So that's about 5 heaping tablespoons of energy. And then, you know, I'm not going to do something in between that's going to take more out, because I need to reserve that for when I need to do laundry, which is going to take 3 tablespoons or whatever. Hopefully you can get my point with that. But essentially, it's thinking about how much energy does each task take, and maybe you want to save some of that for the next day. Which leads to the next point of smaller to-do lists. You know, not having so many things on your list can help reserve some of that energy for some of the things that that you know is going to help improve, like exercise. Seeking support is so important from friends, family, whoever you're surrounded with. And then I emphasize, you know, engaging in things that you love, that you enjoy. And that is all I have for you, so that we have time for, you know, question and answer, and hearing from your voice as well, as far as what's worked. We have this resource page that Michelle put together. I think it's so useful to have this. And we discussed, you know, having this available for you guys. as kind of your take home from this too. So these are resources specifically on MS and fatigue. So Michelle, I'll hand this back to you. I think.
Thank you. Yeah, if you want to put slides down, that would be great. So now we're back, and I'm going to unmute everyone. And when I do, you can